Hi, I'm Allie Josie with Auburn University's Family Nurse Practitioner Program, and I would like to talk to you about plantar fasciitis. Plantar fasciitis is a painful, inflammatory overuse injury of the plantar fascia located on the bottom of the foot. Plantar fasciitis is caused by collagen degeneration due to repetitive microtrauma. There are several risk factors in the development of plantar fasciitis, including overuse, such as with runners, flat feet or extremely high arches, obesity, age, improper footwear, and it is most common in middle-aged women. Three key questions to ask the patient who may have plantar fasciitis include: where is your pain located? The pain should be located on the heel of the foot. When is your pain the worst? Typically with plantar fasciitis, the pain is the worst first thing in the morning upon getting out of bed and taking the first few steps. It also may be bad after sitting for a long period and taking a few steps. Typically with activity, the pain tends to lessen. The pain with plantar fasciitis may also be triggered by standing for long periods of time. And the final question to ask for the diagnosis of plantar fasciitis would be: have you done anything specific to injure your foot? This question helps to rule out trauma that could be the cause of foot pain, like a fracture. The top three physical exam components of plantar fasciitis would be point tenderness in the anteromedial region of the heel. A second component would be that the pain increases with the dorsiflexion of the foot. And finally, the Achilles tendon should be examined for tightness. Treatment for plantar fasciitis is varied. Usually it goes away on its own within 12 months. NSAIDs are a common first-line treatment like Aleve or Motrin. Ice massage works wonderfully for plantar fasciitis, and you should do this 4 times a day for 15 to 20 minutes. And one really effective way of doing ice massage is to freeze a water bottle, place it on the floor, then place your foot on top of it, and you can roll your foot on top of that water bottle, bearing down as hard as you can stand to really work that coldness into the heel region. Another treatment would be taping of the heel and ankle. Night splints can be worn to help relieve the pain, especially first thing in the morning. Some people are put in short leg casts or special orthotic splints. And if the pain is really intractable and none of the above treatments have worked, you may consider getting a cortisone and or lidocaine injection into the region to improve your pain. 3 teaching components that are important with plantar fasciitis include wearing shoes with sufficient shock absorption. You should never walk barefoot, and your shoes should always have plenty of arch support. Rest is a big component. You shouldn't be up walking around, staying on your feet for hours at a time, and you should teach your patients how to do strengthening and stretching exercises of that area and region of the foot, and only do low impact exercises. So for example, if your patient is a runner, it's important for them not to run until the symptoms resolve, or it's only going to get worse. They need to do low impact activities like swimming or a stationary bicycle, something that is not putting a lot of pressure on that heel region. And a third and final tip for plantar fasciitis that you must impart upon some of your patients would be weight loss. Obesity, as I said earlier, is a major risk factor for plantar fasciitis, and sometimes just losing a few pounds can make a huge difference in the pain with plantar fasciitis. Thank you. Have a good day.